repatterning. Knee pain can be caused by a number of different things, with the most common being acute traumatic injuries and pain due to overload, compensation, and poor movement patterns. So, because you've been following these videos, you know that improving and restoring your mobility and activating the right muscles is critical to making permanent positive changes to your knee situation. But these alone won't completely fix the problem. You really need the keystone to hold the arch up. So similar with your knees, you need to re-establish correct movement patterns again. Now, it may have been an old injury, or the fact that you may have been performing activities with less than optimal form, or not doing enough activity at all that's caused your knee problems in the first place. This DIY knee revival course takes you through a unique and functional approach to the rehabilitation, and the next area focuses on re-educating movement patterns that get changed or interrupted after injury, surgery, or inactivity. Right, so you're going to learn a series of functional techniques that you can immediately use to help your own knees feel better. So, how do these movement patterns end up going so wrong in the first place? Well, when your brain senses pain or discomfort, it makes moves to reduce, inhibit, or stop you from being able to load the area that's causing pain. So this is a great strategy to reduce your pain for a short while. Now, the bigger issue comes when this inhibition of certain muscles or movement patterns sticks around for longer than it should. And this can happen when the pain trigger is actually healed, but your compensatory movement patterns are still trying to avoid the old pain that doesn't actually exist anymore. So let's say, for example, you catch your left heel and your Achilles tendon hard on the back of a step while you're rushing, and it gets really badly bruised for a few weeks. It's really painful, so your body naturally changes the way it moves in order to avoid causing pain by not loading the injured tendon and the muscle and the surrounding tissue there. Now, life goes on, and you still need to do all of your daily activities. You still need to work, you still need to get your kids ready for school, you still need to go and do your workout, whatever. Right, your body gets it done, but in order to avoid the pain, it begins changing your motor patterns to load your other leg more, which reduces the weight and therefore the pain on your injured leg. So the result of this is a compounding problem, because the muscles and joints that are trying to help are working overtime, as we spoke about earlier. And like anyone, eventually enough is enough and they just quit working. This is the point at which you really notice your knee pain starting to get bad, and it might just be the uninjured side that causes you more pain in the end. So that weakness and or stiffness causing your knees to move in ways that they shouldn't and force them to do far more work than they're meant to, and over time this daily assault causes the knee to get worn out, painful, and eventually suffer permanent structural damage. So look, at the end of the day, it's a movement-based motor control problem, and we need to treat it like one. People are always asking me, right, once my injury's healed and there's no bruising or evidence of the injury even happening, shouldn't my movement patterns go back to normal and I'll be loading everything evenly again? God, if only that was the case, right? That would be great. I'd be out of a job. I'd probably move out to the country and start a little hobby farm somewhere. But in reality, unfortunately, the way our neural system works means that once we change that movement pattern, that's the way it's gonna stay, unless it has a really good reason to change or enough stress to change. So lucky for you, I've spent many, many years studying, testing, and refining exactly how to get these movement patterns to change back to the way we want them. So you've done your mobility and your activation work. All you need to do now is to correct any haywire movement patterns, which requires our repatterning exercises that we've already talked about a bit. By following the program in the order that I've set out, you will have improved your range of movement and your mobility. Your body's able to get into the correct positions. So once you've done all your activation exercises, you've got all the right muscles ready to fire, and the incorrect muscles are inhibited, and they're going to be less likely to work when you're trying to get the right ones working. So now you're ready to repattern your critical movements. Once the brain has formed a pattern, it will repeat it over and over in the same way. So changing the pattern, once it's ingrained, requires more work than establishing the pattern in the first place. It's estimated to take about 10 times the initial number of repetitions to have to be performed in the new way to overwrite the existing pattern. And it takes about 300 repetitions to ingrain a new movement pattern, depending on its complexity. Now, the implications of this for you are that spending time getting a pattern right early on saves a mountain of extra work later if you want to change a problematic movement pattern. The act of building a motor pattern or learning a skill gradually progresses from a lot of thought and a little understanding to little thought and a lot of understanding. So every single inch of every single repetition builds a motor pattern. I suppose what I'm really getting at here is the fact that you need to make sure that you're doing them correctly. You're feeling the movements in all of the right places and not where you shouldn't. In the program, as I've said before, I've noted down where you should and where you shouldn't feel each exercise to make this as easy as possible for you. The only person who can feel them is you, and with my help, you can do this. Movement pattern correction is an integral component of the DIY knee revival course and the results you'll get with our treatment. While our mobility work provides a window of opportunity with improved pain and range of motion, it's movement repatterning exercises that we'll utilise to regain the strength, speed your healing, and resolve your pain-provoking compensation patterns that you've developed over time. Ultimately, correcting movements is the best medicine for most of the ailments that we see in our clinics. Fixing your knee requires tissue to be progressively loaded, and over time the structures will positively adapt to the stresses that we place on them. And when conditions are acute and inflamed, it may take a little bit more time, a bit more customization of the program, and more gradual progression and perseverance. As your knee pain becomes less acute, we're going to begin to load the tissues and joints with more exercises to allow the tissue to adapt. So a critical thing here for you guys to really take note of is the fact that first I'm going to teach you to move well, and then I want you to move often. This stuff really does take time. It takes effort and it takes consistency to make it work. Sometimes it hurts. Sometimes you want to quit. You've got to ask yourself, how badly do you want to be pain-free? How badly do you want to be able to make your knees do whatever you want or need them to do? Some people dream of pain-free knees every night, while other people get up every morning and they make it happen by following my program. It's up to you to choose which person you are.